From the Daisy nomination received during the month of February, the winner is Susan Hiers. Susan has received 7 nominations since the program began. Like many of our Daisy winners, Susan received the most votes based on the strength of her nomination, not just one. Nomination 1. Susan was unfailing, kind, patient, and supportive to both me as a family and to my family. She incorporated excellent, tender physical care, and at the same time, she made sure my emotional and spiritual needs were met. A patient and a human being cannot ask for more during what was been a trying, painful, confusing, and exhausting weekend long. God bless Susan. Nomination 2. Susan was our nurse during my stay at Lewis and Peaches Orange Heart Hospital. This woman certainly has a heart for nursing and so much compassion. She was always trying to help in any way possible to make our stay as pleasant as can be. She was an LVN. I'm not sure this statement is exactly true, but she was an LVN going to school to get her RN degree. We think she's a great asset to Trinity Mother Francis.
We were still on 4 in Ellis.
We were on 4.
Yeah.
Okay, thank you. Nomination 3. Susan was very friendly, very kind, and very concerned, but most of all, she was professional. She made me feel like she was doing all she could to make my day better. From the first time she came into my room, I felt a certain spirit. Susan loves her work and is, quote, God sent. I thank her with all my heart. One of the patient care associates said that she loves working with Susan. I can just imagine. I hope she is part of Trinity Mother Francis for years to come. She is a blessing. I feel like I made a friend today. Nomination 4. Susan is a very compassionate and caring nurse. She has gone above and beyond her call in nursing, taken time with her patients, me, with a very pleasant and happy attitude. She has done more than a nurse. She has been the patient care associate, the housekeeper, and the fixer in helping and keeping things in order and helping me get things during my stay. I really think she's a jewel. She deserves to be recognized and rewarded in some way. Susan is wonderful. Nomination 5. Susan was outstanding. She was very compassionate about my concerns and my needs. Nomination 6. Susan was attentive in an exceptional manner. She provided reassurance and understanding of the process and expectation of heart surgery. She provided us with a written printout of information on final diagnosis. She took the time to get to know our concerns, so we felt comfortable to approach her about my husband's condition and ask her questions. She left us feeling comfortable to face surgery, both spiritually and physically. And most of all, her personality was a plus. Nomination 7. Susan is very passionate about her job. She went far and beyond her duties. Her people skills are off the chart. She made my stay here very pleasant. She's very professional, very patient, and very responsive in meeting needs. I can tell she cares for the wellness of her patient. She is truly gifted. Thank you, Susan. Now, on the behalf of the Daisy Foundation, to proclaim you Susan Hiers, a Daisy and extraordinary nurse, here's your award, and I would like to read it. The Daisy Award for Extraordinary Nurses. This award is presented to Susan Hiers, RN, in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people. Congratulations. And I would like to present the Daisy pin. I guess you know this gentleman. The Daisy pen is penned by Fred Brewster, and he was part of our brewer. This has Susan's significant others. The other thing that we have is the sculpture I want you to have this sculpture as a symbol of your recognitions today. The banner will be hung in our unit for the month in your honor. And now the gift of all, a parking pass. Wow. And the ever famous parking pass, in which the winner will have free reserved parking in the parking garage for 1 month. Now the message from the Daisy Award Foundation. You okay? Mm-hmm. Okay. Did I do good? Did I keep the surprise?
You did good. How long have you known about this?
Forever. Yeah.
Give me some warning.
Okay.
Some makeup on.
I tried. By definition, the Daisy Foundation thinks all nurses are extraordinary, and we wish we had the resources to honor all of you individually. Nurses who receive the Daisy Award often say, everyone in the unit deserves this award as much as I do, or I don't deserve this. I was just doing my job. What the Daisy nurse may not realize, however, is that when nurses are just doing their jobs, they have such an important and meaningful impact on the lives of so many people, many more than their patient. At every Daisy Award presentation, we ask each nurse to pause for just a minute and realize how very special they are and how they make the world a better place by just doing their jobs. Today, a nurse's job entails many things, but no matter what the day brings, a nurse impacts an invaluable and long-lasting to their patient and family. Thanks for your education and training, your commitment and judgment, your compassion and connection with your patient. You are very special. You make the world such a better place by just doing your jobs. The skill and compassion you bring to patients' care make a patient's outcome more positive or make a family member feel a little better so they are better able to help with the patient's healing. Please think about the impact you are having. Story after story bring this to light. I would encourage you to look at the National Daisy website and read the story. The link is on Nursing Public. Prior to our closing, I want to give special thanks to those patients who nominated Susan, and many of those we did contact and they send their best wishes, and they hadn't been able to make it today, but they do really appreciate you receiving this award. This award does not happen unless you take the time to write the nomination, and it means a great deal that you care enough for Susan to do this. Thank you for choosing nursing as a career, and for the skill and care, compassion you give to our patient every day. Again, congratulations, Susan. Thank you.